have a treatment as part of our training as a model. So the situation is the nurses are consolidating their training, ready for us to launch the treatments across the whole network. So that's quite exciting. So they're already qualified nurses, they already know how to take blood, they're just learning how to put it back in again.
Okay.
So what's made you come in for the treatment today, other than being asked to be a model?
Just the fact that I've always wanted to try this treatment, and obviously being a client of the practice anyway, having all your other different things that I've had done here. I trust you guys, and especially you, Emma, and I thought, I thought, well, I'd give it a go. You know, age-wise, skin laxicity, that type of thing. I've heard it's really good for just, you know, obviously general collagen repair, and I think stem cell repair type of.
Using your own natural abilities, you know, it's a bit ironic, but you're paying us to take your blood out and put it back in again. But we express injuries, and we'll do this when we do the consultation. But you express platelets when you have an injury. You know, and we know from doing the other treatment that we do. And you've not had anything like this before. You've done things like peels and needles.
I've done derma roller.
Yeah.
That's it. Yeah. And you know, Botox I have, you know, on a regular basis, and filler and things. But I do know that obviously by having the derma roller before, where it damages your skin, it then repairs and brings you lots of collagen. So I thought, well, this is probably an extension of that, using your own platelets to go back into your skin.
Like putting baby bio on your tomatoes, isn't it? It's working from the inside. And it's when you have the injury from the needling, which we also do, and the peels, that stimulates a collagen response and a platelet response. So this is just an enhancement of that. So we're actually putting it in there, because you only express platelets when you've had an injury, whereas we are actually taking them out and saying, hey, we're actually sending the soldiers to the battlefield. Brilliant. What are you expecting it's going to feel like?
Oh, stingy.
We're going to put plenty of local anaesthetic.
That's absolutely fine. No.
But it's quite a quick procedure. I mean, you're taking the blood bit and the history sort of thing. We know each other anyway. So basically what we'll do is we'll take the blood, we spin that out in a closed system, and that separates the old blood from the platelets, and then we can draw them off again closed, and we'll inject those into different areas. So sometimes we may sort of use it a bit like with a filler. We can actually fill it into gaps. It's not going to act like filler. It's a bit safer than that, but it gives quite a plumping effect to the skin as well. There might be some tingling, a bit of discomfort for a day or so. You might have a bit of redness, a bit of irritation, but pretty much most injection sites will close down after about 10 to 15 minutes. A bit like when you have when you have your COVID multiple jabs or not. Okay, and after the treatment, we'll give you all the post-treatment information. You'll get that emailed, and soon we'll have a nice big booklet. But treating it, you know, just sensibly for you know, not touching. The hardest thing is not to touch your face.
Yeah, I imagine it's a similar thing to derma roller. Keep your hair away from it, sort of thing, because you know it's been opened at one point where you've put an injection in it. Just be, like you said, sensible.
It might be a little bit sort of achy for a bit. You might get the odd little bruise where we've gone in. We can't stop that. And actually, one of the things that the numbing cream does is it closes some of the blood vessels down, so it should reduce that. If it's really uncomfortable, you can either use a cold flannel or a warm compress on there. Plenty of moisturiser inside and out. You know, keep those levels up. The first, you're not going to see results straight away. It's an ongoing project.
Absolutely. It's like I think it's something like anything 6 weeks and 3 months. A bit like the derma roller, but I think it's an ongoing thing, because then as your collagen starts to produce, is that right? Is that correct?
Anything that stimulates collagen has a build project of a few months, and what we find is that when you injure it again, when you're in that new collagen phase, a bit like with the other treatment that we do, that it keeps it going for longer. So, and none of us are getting any younger, so you know.
This is it. Exactly. Upper hill.
Well, this is it, and you can complement it with the needling, with peels, with the new skincare ranges that we've got, which I'll talk to you about in a minute.
Cool.
People aren't going to say to you, "Wow, what have you had done?" It's more.
I think it's maintenance. For me, anything that I do is like a maintenance thing to keep it going. I mean, I eat healthily, I drink lots and lots of water, I exercise regularly, and these for me are always the things that seem to add to it. You know, I think my skin is, you know, it's quite okay, but it needs, you know, it's an upkeep. It needs absolutely of course it is, and I do like trying. You know, I've thought about this for a while, and I've done a lot of studying, and I've read about it. You know, I've read where you can use this for healing of injuries, knees, elbows, that type of thing. So I thought
the thing with PRP is it's been around for quite a while in terms of the science side of things. Nobody knows the correct way to do it, but there doesn't seem to be a wrong way. And this seems to be sort of the methods that we're using now are sort of tried and tested. Though, you know, the important thing is these sort of closed systems that we use reduce the risk of infection. There's no risk of you reacting to it because you're...
Absolutely, yeah. So you're not putting a filler in that you could end up, like you said, having a reaction to, or over-filling, which can be another thing that, you know, I've always worried about in case someone puts filler in and I look like, you know, I'm too filled up, basically.
Yeah. And it's quite a nice natural glow to it.